Hello, everyone. Good evening. Depending upon where you are in the world, it's morning time. So, hello and welcome to the Front Seat Life and Impacting Love Global Ministries event, COVID-19 vaccine. Should we take it or not? So, we are live both on Facebook and in YouTube. You can leave your comments and questions in the comment boxes, and we have a monitor that is checking all the questions. We want this to be an interactive conversation. There are two amazing guests that will be sharing their knowledge and having a conversation with us tonight. As we know, COVID has ravaged the world, and here in the United States, communities of color in unprecedented numbers. So tonight, let me introduce our guests because we only have an hour, and I want to make sure we get to the questions and get to the conversation. Our first guest is Dr. Joynicole Martinez. She's an award-winning epidemiologist. She's the founder of the Alchemist Agency. She's an international keynote speaker. She's an executive coach and trainer. She's a member of the Forbes Coaches Council. Dr. Martinez has 20 years of experience providing policy and operational development, strategic planning, performance management, and the like. That's just the corporate stuff. But listen, as a community advancement and population health expert, Dr. Martinez has developed initiatives that reach across disciplines to strengthen health and wellness, including the development of mixed income and mixed finance housing communities that really address social determinants of health. You guys know that's my thing, and health equity, racial equity, and human rights. She's a subject matter expert for the National Health Care for the Homeless Council and is a SheSource expert in the area of business and the economy, health, and social justice. I present to you all Dr. Joy Martinez, who is also, shall I note, a contributor to the Carolinian newspaper and Black Enterprise. She didn't put that in her bio, but I did my research. So I welcome with us this evening, Dr. Joynicole. You will see her in just a moment. Our second guest is Apostle Garney Davis Jr. Apostle Garney Davis Jr., I will say, full disclaimer, is my pastor, but that's not why he's here today. And I just lost his bio, so outside of being awesome and amazing, he is the senior pastor at Impacting Love Global Ministries. He is also the director of pastoral and spiritual care at Erie County Medical Center. He's a son with a servant's heart. He is a teacher, a preacher, and has many roles, not just in our local area, but across the globe. He's the chief chaplain for International Police Fire Chaplains Association. He's the regional director of evangelism in the Northeast Central region for Full Gospel Baptist Church Fellowship International. He is the apostolic leader for churches in South Africa, Haiti, the Dominican Republic, and Jamaica. And if you don't know him, he is a specialist in trauma. He has spent many years as the trauma chaplain at ECMC, experiencing life in ways that we could never imagine. So I welcome both Apostle Garney Davis and Dr. Joynicole Martinez. Good evening. How are you guys? Oh, now they can hear you.
There we go.
Oh my goodness. So thank you both for agreeing to come together tonight. We all wear so many hats, and we have some comments already. Hi, Ray. We have someone watching, and she says she chooses Sriracha for two reasons. She wants the info that we're going to talk about tonight, but she's also working as a contract chaser in Western New York. So I, believe that tonight is going to reach so many people in various places and ways. So why are you guys here? Ray shared with us why she's here, but why did you guys choose to be here tonight?
You go first, Joy.
Okay. I would say two reasons. First, as an epidemiologist, I primarily focus on infectious diseases, but I focus on how it affects global populations. And there is no more infectious disease that's been more global, right, in impact than COVID-19 that we've seen in our lifetime. But that also comes with this, the birth of COVID is also aligned with the birth or the growth or this trajectory in social media. And so what I'm finding is that we're fighting a disease, right, while fighting so much misinformation, disinformation. And so I felt it necessary to be here because the doctor part of me wants to make sure that we're making decisions based on fact, not fiction and myth. But the other part of me says, as a Black woman, as a person who identifies with a minority population, as a mother, as a wife, as a daughter, right? I want to make sure that we have the best information to make choices for our families, for our households that we can have, because that has been our obstacle. Our obstacle has been is the information hasn't been given to us historically the best way or in a way we can receive at our levels of literacy or in a way that was factual for us. So I think those, if I had to break it up into two, because there's a myriad, those would be the top two reasons why I'm here today.
Well, I'm here because my quotidian is to help my community, my church family, and my family. This COVID-19 has impacted the world, our nation, and our communities. And as a Black man growing up on the rough side of town, or the rough side of the mountain, I want to make sure that we have all the information necessary and needed so that we can make the right decisions for our families. I see too many individuals coming inside of the hospital and dying from COVID daily. I read about it daily. And so I want to make sure that everyone that I'm connected to, be it friends or family, associates, colleagues, that you're listening to gain the information that will help you make the choice for you and your family. Everyone that's connected to you. That's why I'm here. And I love people.
Amen.
And so you both know Front Seat Life, my focus, my mission, my life is mental health, and wearing all of these hats that we wear, racial equity plays a large part in the work that I do as it relates to mental health, but also in trying to address the social determinants of health. So for the folks that are watching, I just want to quickly give you an overview of what social determinants of health are and why COVID is reaching communities of color in the way that it is. So our health is made up, if you consider yourself a pie chart, right? Like you've got percentages of yourself that make up your whole health. Access to a doctor, access to healthcare only makes up 20% of your whole health. Now, everything that we talk about, is a lot about getting to the doctor, call your doctor, make sure you see your doctor, but your education affects your health. Where you were born affects your health. We can tell by your zip code how long you're going to live, right? And that is because of the social determinants of health. Because if you live in a certain neighborhood, you have certain access, you have certain resources or lack thereof. You may live in a neighborhood where, there aren't many homeowners and, maybe cities don't take care of those communities and neighborhoods. Racism is very real in America. That is not something that anyone can really ignore at this point without doing it willfully, right? And so because of all of those factors, you have this picture of health, right? So coronavirus, Black folks, when we talk, oh, I got the sugar, I got high blood pressure. but I'm not claiming that. And I want to really impress upon everyone that you don't have to claim it for it to claim you. And that's not just high blood pressure and diabetes, that's the coronavirus and COVID-19, right? So we want to give you an opportunity to make an informed decision. Whatever you choose, vaccine or not, we want it to be an informed choice. We know they and what they say and what they do, but we're going to leave them where they are. And we're going to have an honest conversation. We want to hear your fears. We want to hear your questions. This is an opportunity to ask two experts things that you want to know, right? So, Dr. Martinez, let's start with just the coronavirus, right? What is it, and why is it so different than all the others?
Okay, so let's just start with a basic virus, right? A basic virus is just a living thing. If you look at it that way, it is one of the most prolific or populous living things on the planet. Okay, it doesn't do anything to humanity until it starts to invade our person, starts to invade our body. So most of us have seen posts where it says, well, I see coronavirus on the back of my Lysol. I see coronavirus. So they already knew about this COVID-19. Coronaviruses have been around for a long time. It's one of the family of viruses that A, can affect humans, and B, it kind of has an envelope. We think about it this way. So certain viruses or living things have an envelope around it. This particular coronavirus, and this is one of 7 or perhaps 8 that we know can affect human bodies out of this family of coronaviruses. This envelope, we see a photo of that all the time on the news. It's that circle with the spike proteins you see coming off. That's this envelope that sits on the outside of it. Viruses that have that type of envelope, like a rhinovirus, like a code virus or coronavirus, when you disrupt that envelope with something as simple as soap and friction, they become weakened and they die. So viruses are prolific on Earth. There's nothing strange about a virus, just like there's nothing strange about bacteria. We need all of them for our human life ecosystem to exist. This particular virus is novel. This particular coronavirus with this particular spike protein, or that envelope with those proteins on the outside, that is novel. It is in a family of viruses that comes from SARS, which we all mostly have heard about in the last few years. This is what we would call the second variant of the SARS virus. Okay, so you sometimes see coronaviruses or COVID-19 referred to as the second SARS or SARS variant 2. What's different about it? The transmission rate was different. So we were always expecting something. And I say that as an epidemiologist. We've known for a long time some virus, there was bound to be, because of increased travel in the world, because we have more air travel than ever, right? So we're crossing boundaries all the time. We're interacting with each other more, and that comes with consequence, good and bad. So what makes this different is that this particular novel coronavirus came upon us in a time we weren't expecting. We didn't expect this rate of transmission, knowing something would happen. If you remember, we had the scare a few years ago about the swine flu, right? Everyone said, oh my goodness, it's going to become an epidemic. It didn't, because we were already expecting something. And so our interventions were fast, and it didn't move as fast as it would have liked to. We were able to stop that. COVID moved quicker. It was faster. So what's different about it is that the spike protein just wasn't as disrupted as quickly as it was transmitted.
Okay.
That's what makes it different. I know that's very technical, but at the end of the day, it literally moved faster than we were expecting it to move. And we didn't disrupt it fast enough to stop it, knowing full well some type of pandemic was coming.
Wow. Thank you for that, and putting it in those words. I got it. I did. I did get it. Um, Apostle, can you just tell us what you're seeing? We have this technical piece now. Can you tell us what you're seeing in the field?
Well, what I'm seeing is that this virus is not prejudice. It is killing Black, white, Hispanic, Christian, Muslim, Baptist. It is has no respecter of person. And I'm looking at young people die, 35 years of age, to older folk well in their, above 70. And my concern is that there's so many conspiracy theories out there that has really brought up barriers that has now caused those who are prone to African Americans prone to this virus to die from, that we have this reservation of getting the vaccine. And I know we'll talk about that later. So my desire is that because of what I see, and then even what I hear, there's people saying that it's, that this virus is not real, that is man-made, this, that, and the other. And my response to that is, listen, over 400,000 people have died from it. So if it was man-made, if it was created in somebody's backyard, it is killing folk. And we need something to save lives. That's what matters to me. And when it comes to me and mine and those connected to me, I need us to have the right information so that we can move forward, that we can save the lives of those we love.
Thank you, Apostle. We do have some comments. Ray is she is a contact tracer, and she shared about the type of training that they receive, about culture and background. They do acknowledge that racism is real in the training, right, which is new, right? How many trainings have we all been in and taught? And you start talking about race and racism and historic trauma, and you get side eyes, and that's not real. That can't be, right? Everything is good. Everything is fine. Yet here we are. So, Ray, thank you for sharing in the comments with us. Michelle says she met somebody today that did take the vaccine and they look fine. They had no side effects yet. We're going to talk about side effects and we're going to save the big question for later on who in the meeting tonight has taken the vaccine and what their response has been or not, if anyone here has taken it. So you'll have to stay with us, and we'll be here till 8 in order to find out that's going to be the big reveal. Who in the room has taken the vaccine, first shot, second shot, Moderna, Pfizer? We'll see. So please continue to answer or ask your questions and put them over in the chat. So you told us about the virus and how the virus works and why this one's different, and we needed a little more friction than normal, which I'm guessing that's where the 20 seconds came from, right? Instead of just 10 seconds, we have 20 seconds of hand washing. So what about the actual vaccine itself, right? So 2 questions, take your time with it. What is a vaccine, generally speaking? And is this particular vaccine different? If so, how is it different?
Okay, so generally, let me start with a vaccine that's more likened to this one. So we've heard for years, take a flu shot, right? A flu vaccine. So there are different families of vaccines, what we would call like school immunizations. That's one family of types. This type of vaccine is a little bit different because it responds to something that's shifting, changing, or mutating, right? Like the flu. So every year the flu comes out, there are strains of the flu. The flu changes a little bit every year. The different types it's all the flu, right? It's all the same flu, but there's a little bit difference in how it's made up. And so we get a different body in that vial. So it approaches that flu a little bit different. The coronavirus is that the vaccine is that way. This vaccine is different in that it was not developed to, and this is going to sound strange, but this is truth. It was not developed with the purpose of killing coronavirus. Let me just explain what I mean by that. You can have a flu shot and still get the flu, right? I mean, we've all known people who have gotten a flu shot. This was developed so that if you were infected with COVID-19, your symptomology or how you reacted, how your body reacted would be faster, so you would not get as sick, much like the flu shot. So there are some shots or vaccines or immunizations we get, like chickenpox. You know, where my generation, we just got chickenpox. And if you didn't have it, you went over to your cousin's house and got it, so you wouldn't get it later, right? Just go over there and rub on a little bit, stay close, let a hack on you so you get it, right? My children have been immunized. They will never see chickenpox. This was developed differently because, and I don't want to get ahead of our conversation, but this was developed because, and this has to do with its rapid development, we needed something that would help people stop dying. Do you see what I mean? So its development was rapidly moved more to respond to the rate of severe reaction to this virus impacting the body. So when we talk about this vaccine, because I've heard people say, oh, well, I'm gonna get the vaccine, I'm gonna take my mask off and be free. And I just want to help us remember, this vaccine is like the flu. The same way every year they say, please, wash your hands, wipe your nose, cough in your, don't use a sanitizer. This vaccine is in that family. While we see immunity happening, it was developed to move symptomology, not necessarily to just destroy COVID-19 on the globe. That's what kind of vaccine we're talking about. The second part of the vaccine is where we start to come into a more long-term immunity, which make us move towards herd immunity, which may make us get rid, quote unquote, of COVID-19 and move it from pandemic to, well, I won't say that. Move it from pandemic status. Now, I will say this. I personally believe COVID-19 will be endemic, like the flu, meaning we will always have a season, cyclically, where we're dealing with COVID-19, much like, the flu or influenza is endemic. We deal with it cyclically. So that's, we get vaccines all the time, right? We get them for school, for work. At my job, you don't take the flu shot, you're not coming to work. You got to get a legal waiver. You can't enroll your children in school without a set of immunizations. This is how we move diseases out of our population. So I just want to be clear that the development of this vaccine was in response to the deterioration of person or how symptoms developed and rapidly escalated, and which makes it very different from others and more like the flu vaccine.
Thank you so much. So what I'm hearing is, and correct me if I'm wrong, that the vaccine was created in a way to minimize the effects of the virus. So the death, right? The long-term effects, which we have no idea what those long-term effects are. Many of us know people that have struggled with the disease who are still experiencing side effects of the virus, but yet their body is clear of the virus. But one of the questions that came up in the chat was about the length of time it took for the vaccine to be developed. Now, I've read some articles, but I would like to have you answer that. Why was the amount of time from research to market less than it's been for other vaccines?
First, This vaccine uses what we call mRNA or messenger RNA. And while that may sound strange, and in some cases it is, they've been working on mRNA since 1990, 91. This is not new. So I'll give you the technical reason. The technical reason is the research was already kind of in the hopper, right? That's the technical reason. Usually it takes 7 to 10 years to come up with a vaccine. Now, here's the real reason. Money. When you have a global pandemic and people are dying and economies are crashing and people are at home and businesses can't survive, people are motivated. And so there's no motivation in moving a vaccination forward so quickly because it affects a small population of people, right? When you start affecting millions and billions of people, all of a sudden, countries, states, nations, organizations, private and government funded companies can come together and move technology forward. And so there were shares of research and patents that had unprecedented sharing of information that we've never seen. But let's just be real, money. Money moves people, right? And unfortunately, in healthcare, we all know this, money moves people. And so part of it was that the research was already there. Again, it had been started in the 90s. Even by 95, they were testing it on mice, which may not be great for some of you, but that's just where we were. So, by 2020, this had been a foregone kind of conclusion. And then just the move of the economy tanking globally pushed it forward rapidly because people, wealthy people want to stay wealthy. So, yeah, that's just the reality.
And that's keeping it real 101, folks. It's about the money. Apostle, can you give everybody the scripture about unity?
So there's a couple, but over in the Bible, the book of Genesis, the Bible says that God says unity gets his attention. And here was a group of people who decided to build something. And because they were one, God said there was nothing they can't do. If we really unify, we can accomplish a lot. We're better together. And so listening to Dr. Martinez, we were desperate. We were in a devastating place, and we had to come together and unify with all our different backgrounds and educations and science regarding this to save our lives. And even in the midst of that, in the United States, we lost close to 400,000 people already. So, yeah, we needed to unify.
Thank you, Apostle. One of the questions we have in the comments is about, I'll just read it verbatim. I don't want to get it wrong. Please, Dr. Martinez, talk about the fact that China and other Asian countries had more cases of COVID-19 and they have not utilized a vaccine, but the cases have decreased to almost none. So can you talk about that? Is that factual, or what do the numbers look like if you have that information?
Yes. So none is relative in my world. But I will say this, America is unique. America is unique in that A, we are a democratic republic, and B, we have sovereign states. So many of the other nations dealing with COVID were able to shut their entire countries down. As an epidemiologist, I've worked all across the globe. I was, as a matter of fact, one of the awards you heard in my bio was in response to Ebola. Very different response because the government could just shut the entire country down. The United States is such that states determine, governors determine whether or not they're responsive to recommendations by our federal government. So you had some states that went, I don't care what they say, I'm not shutting down. When I traveled to Russia, when I traveled to Australia, their entire nation, Italy, their entire nation was on complete lockdown as a nation. So there was no difference between a boundary between a New York, New Jersey, a New York, Canada, because I work in North Carolina, but I live in South Carolina 5 miles down the road. One's closed, one's open. That is a very unique thing that happens in the United States. So it has less to do with the vaccine and more to do with the structure of our government and the ability of our sovereign states to respond or to decide not to respond to a federal recommendation. In our country, it is a recommendation. It cannot be given as a mandate. You've probably heard, "Ooh, will the president give a mandate?" Well, the truth is, even if they gave it, the state still has the authority to say, "We don't want to do that," and move on. So you are right. There are some countries that were able to very quickly close down, shut their country's borders, stop travel between areas, regions, or what we would consider provinces or states. And in America, that is quite a challenge to do.
Thank you. Were you going to say something, Apostle? Oh, wait, I'm sorry. I have you muted for feedback purposes. What were you going to say, sir? I'm sorry.
Well, I just simply said, wow, because I was thinking about in South Africa in the early parts of 2020, they shut down all of South Africa for 21 days, and their numbers dropped tremendously. Then they had a spike. And I don't know if they did another shutdown, but them shutting down, I believe, is what saved many lives. And then also some lives did succumb to the virus.
And we, just the three of us don't live in bubbles and in isolation. We all know many people that have been sick, that have passed away, that are still sick, and we have to. I would love for us to get past this individuality, right? It is my life. I can do what I want with it, how I want with it, and if it infringes upon you and yours, and that's just too bad because this is my choice, right? And while I agree with that, there are certain times when you have to come together and unify and do what's best for the whole. How that rolls out, that's a whole nother conversation that maybe we can get together and have. But Dr. Martinez, can you speak to positivity rates or the length of immunity an individual has once they have had COVID? And, so can they get it again in a week, in a year? Do we have that information yet? Because it's only been a year, not even a year yet. So we're not quite sure. Best case scenario, we're talking 10 months. But within this 10 months, is there any idea of how long natural immunity will last?
So I'm going to state this. I'm going to give this disclaimer. I study infectious diseases on a global scale, but I also study infectious diseases in the BIPOC community. So when I say BIPOC, I mean Black, Indigenous, and persons of color. Okay, so that is significant for me. If you've had COVID, what we're seeing is there's somewhere between a 5 to 25 week period where it's possible, and I'm saying possible, you're not transmitting that illness and that you can't be reinfected. However, and let me say, we've also seen that they've been immediately reinfected. And let me explain. Immunity works in your body. We've seen many clusters of COVID and 3 major variants or mutations. So it may be that you were infected with the original, for lack of, I'm just trying to make it simple, the original variant of COVID. And then 2 weeks later, the UK variant of COVID attacked your body and your body didn't respond to that the same way. And so you were not immune. So when I say 5 to 25 weeks of immunity, I'm saying That is relative. That is nowhere near definitive. Nowhere near. And unfortunately, even now, we have more studies that are coming out of more wealthy populations, more physician cared for populations. And what we're finding is that in the BIPOC community, they're going to COVID clinics. They may not have they may not have a primary care physician who referred them to an ICU or some specialized care for COVID. So I'm saying that also by disclaiming, saying, please take that with a grain of salt. As it stands, we don't know that you'll ever actually be immune. That is just the truth. That is, if I'm just real about it, natural immunity is very individualized. And because there are variants popping up, we just have no way of saying. What we know is that the UK variant is highly, and I mean highly transmissible and moving quickly across the country. Now we've seen a third variant that's more US based, that as the apostle said, South Africa has its own variant that we see moving across the globe. So like the flu, remember, those proteins on the outside, that envelope can be a little different. Just because you had what was inside the envelope doesn't mean that the outside of the envelope still won't bother you. You see what I mean? So that variant is different. So we say immunity, but again, looking at this timeline, looking at how things have changed, we say that, and it's a bit, we're doing our best. But you're right. We're just talking about 10 months out. And when it comes to viruses and illness in general, it takes years to really collect enough data and enough qualified data to really say if this is what the facts are.
And that immunity is even with the vaccine, right? So if you take both shots, and I hear that there are some one-shot vaccinations coming down the line. So even with that, we don't know how long one will be immune, or immunity is not the issue. It's about decreasing.
Right. So remember, again, we're talking about helping people fight. So the way this vaccine works, right, is it comes into your body, this messenger RNA sends a message and tells your, am I supposed to say that? Is this okay to go here now? Okay.
Yeah, go ahead.
It tells your body.
You go ahead.
Okay. It tells your body, pretend, and I'm saying it's, generally, pretend this virus has attacked your body. So your body starts to build up immunity. It stops at some point, right? But the first few steps that take the most number of days is already done. And then it exists in your body. So what happens is if you actually are exposed to COVID-19, those first, 3 to 7 days, you've already done in your body. So you skip those steps when you really are exposed to it. You see, so now you're not as sick, because the issue is that's when we get the most symptoms. So if you've already done that, your body can respond faster when you're actually exposed to it. You see what so then the thought is that, well, you won't be as ill because your body's responding faster because you've already skipped a few steps because you've had this vaccine. Now, that only works if you've had both doses. So here's the thing. You get the first dose. Everyone says, I'm free. No, you are not free, because we don't know if you still can transmit COVID. Okay. We haven't had studies on transmissibility once you've had that first shot or second. That's not what we're studying. Remember, our initial studies were about trying to keep you alive. Okay. So you still have to wear the mask, still have to physically distance, still have to wash your hands, still got to, wipe stuff down, still got to be safe. Quarantine, follow the rules, stay where you're supposed to be. Okay. You get the second shot. The hope is that your body has pushed even further. What we would call that in my day as a booster. Some of you may have heard that word. We got your baby, they're going to come in, get a shot, then they got to come in and get a booster. The second shot is the booster, okay, which kind of finalizes that process in your body, so that if you're exposed to it, your body says, oh, I know what this is, and it skips those first few steps. None of that has to do with whether or not you can make someone else sick. None of it.
Wow.
That's deep.
Yeah.
Do you see? So when we're talking about the vaccine, I've heard people say, well, I want to keep my family safe. Well, understand, we've not had time to study. Again, think of the name, Operation Warp Speed. We've not had time to study whether or not this is going to stop you from transmitting COVID-19. This is about making sure your body can respond and react faster to this virus penetrating, right? That's what the goal was. People are dying. We can't help our hospitals. Hospitals are overwhelmed, our hospital systems. We can't respond to the heart attacks. We can't, right? We're running out of oxygen. Many states now, including my own, we have written protocols for how we deal and triage very ill people because we just don't have the resources. So how do we get off of that?
And Dr. Martinez, very ill people tend to be people of color. So if you're coming in as a very ill person under this protocol, and these are just facts, right? That people of color, especially Black folks, and when I say Black, I'm purposely not saying African American, because my sister-in-law is on here. She's not from here, and we got a couple other folks. So I'm saying Black for a reason, because once you're here, our society, you can't find a salad, right? Like it doesn't matter what you ate prior to, but the American diet will kill you, and it is killing people of color, not because everybody wants to eat French fries, but you can count more McDonald's, more Wendy's, more Burger Kings than you can a grocery store. You go in the corner store, you can count more soda than you can water or juice. And juice is not the best, but it's better than soda, right? So there are very systemic ways, and I guess this leads into the discussion around racism and the vaccine, right? There are very specific ways and purposeful, unfortunately, reasons why people of color, primarily Black folks, are sick in America. That just is what it is. So this protocol seems equitable and fair, right? Oh, this is what we're going to do. But when you take a step further and realize most of the people that fall in that category are brown, it changes things just a little bit. So I just want to plant that with you guys. That is not about conspiracy. That is about us needing to address poverty, us needing to address racism, us needing to address education, us needing, to address, equitable wages so that people can live off of the money that they're making, right? So this is not just about healthcare. Talk about social determinants of health, that full body of health. This is not just, can you get to the doctor, which is another issue. Can you get to the doctor, right? You have a doctor. Can you take off from work without losing your job, right? So there are so many pieces of this puzzle that we can't address tonight that existed before the coronavirus, right? So let's talk about specifically the coronavirus and the fear that people have about it. Apostle, can you speak to what you're hearing from people and why they're fearful, why they don't want to take it?
Related to Black folk, we've been experimented on, and we have not forgotten that. And so here is this pandemic, and here is this vaccine. Then you have the conspiracy theories that they're trying to put chips in you. Then you have this that we don't trust it because of what they did years ago. And then there's the questions of, okay, what if you're pregnant? What if you, how would that affect your baby? Because it's a lot of questions. And are we the guinea pigs? And then the other thing is that we don't have enough information in the community to show them different, tell them different. So that's why I was so eager to be a part of this, so that we can really get information out to our people. I don't know the numbers. I don't know the statistics of how many white people versus Black people that have taken the vaccination. But what I don't want to do is be the one who, listen, we ran out and we don't have it. That's a whole nother conversation, and I will talk about that a little later. But I do want us to have the information, because the Bible say my people perish because of a lack of knowledge. That's right. A lack of knowledge. And I want to make sure that my brothers and sisters all over the globe get the right information so that we can seek God for wisdom and guidance on what to do, how to do, and when to do. Yeah, because fear is stopping us from moving forward. And we understand fear. Fear paralyzes you. But in your paralytic state, who does that affect? Mm-hmm. You got your grandmother, you got your father and mother, you have your children. So we need the information so that we're not stuck while everybody else is getting what they need to live.
Yep. I want to talk to some of the science and open up. This is also your background, Dr. Martinez. They can hear me talk about racism any day, so I want to, open it up to you. But I do want to just quickly address the notion, fact or not, of chipping in the vaccine and not knowing what's in the vaccine. And that is, if you feel it, then if you feel that that's your reason, then so be it. But we also don't know what's in the Pop-Tarts. We also don't know what's in the cereal. We also don't know what's in the Big Mac. We also don't know, right? And we also carry our phones around. So why put a chip in your arm if you carry around every piece of information that you have with you, right? So again, are they doing it? I really don't know. I don't have that intel. But what I can tell you is it is not likely that they would waste money chipping when you have your information that you're carrying around with you. Everything is here. And in every other app and every other form you filled out, right? But also, we're not getting the shot. So we're not taking the virus, which they know, because Black folks don't take the flu vaccine either. So it's not like this is the one that we're not taking, right? This is the one that's killing us en masse, right? So understand that, guys. I am not belittling. I am not making fun of. Listen, if they are chipping and if you don't know what's in it, right, they still have all of your information, right? There is no, if Dr. Martinez, go ahead.
So I would agree with you with respect to the chipping. I say this, and again, my area of expertise is population health, right? I deal with the population. So I'm not just focused on medicine. I'm focused on health care. It's a very different term, very different. It's very distinctive. To try to chip something and not understand, a vaccine has a needle. The amount of money it would take to create something that could be read by a satellite in the sky as many miles up as it is and put it in a vaccine or just through a needle in your arm would be so many trillions of dollars. You're already spending your own money giving them that information. They don't have to spend theirs. You spend yours. We spend $1,000 to $1,500 on a cell phone, and we will upgrade every year because I want the latest and greatest. And we will turn on our location and go into Messenger and give all of our information away. They have no reason to spend their money. You're doing it for them. And I also understand that people see scanners. I know part of that theory came when they saw boxes being scanned. What we do track and must track is lot numbers, much like your food. Because they have to be cold stored and cold shipped, it's very important that we know if a temperature fails, if it's stolen, we've seen that happen, if it's damaged, if it's contaminated. So yes, they are tracked. The actual vaccine itself is tracked, not your individual shot, so to speak, is not what was being tracked. That's A. B, what's inside of it? There's a message, and I hate to say it this simply, but it's true. There's about 5 things inside, a carrier, much like if you're a person who has natural hair, you understand this. You have a carrier oil, right? You have the oil that will penetrate. You have the thing, right? So fourth thing, two of those things are moot, or they're there to carry the vaccine into your body. It's not really complex. It's a pretty small list of ingredients, which is very different from our history of vaccines in the country. The other thing is, especially if you're focused on the Moderna vaccine, that technology came from a Black woman. And let me just say this, she's from North Carolina, where I now reside. And let me just say this, Tuskegee is real. I'm going to just put this out there. Yes, it is true. If you follow me on social media or you read my articles, you know that the end of last year, I wrote a 4-part series on eugenics in America and anti-Blackness. So this is not going to sound shocking to you. Yes, if you talk about America and the eugenics and anti-Blackness, we know that there's a history of using Black bodies to move forward technology and medical technology specifically. The idea that women of African descent and from Africa who were held against their will, having their bodies ripped apart to make it so white women could have cesarean sections later, it's horrific. And no one should and dare not in my presence ignore the impact the abuse of our bodies have had in getting us to this place. That is just real. So that mistrust, that distrust has real roots. And if we don't talk about them, that further moves us to mistrust and distrust. When we fail to recognize the sacrifices of Black and brown bodies that have made it possible to come to a messenger RNA in 2020, when there was a time you experimented on our children to create a field called pediatrics. And the father of obstetrics and gynecology is the person who also destroyed the bodies of many African slaves. So we can't ignore that when we talk about this progress. And part of our angst and anger and our hesitation, as we might call it, is that you've never acknowledged that. So I can't trust you today because I couldn't trust you then. And because you failed to acknowledge it, we can't have a real conversation about how you've damaged me and those who came before me. So why should I trust you now when you won't even apologize in reality for then? That's the reality of where we are. So we have to talk about that. We have to talk about food deserts and the fact that you specifically plant, we're in a white, affluent neighborhood, they will have a public library. And in my neighborhood, they will have a liquor store and a 7-Eleven or Wilson Farms. We just have to talk about that. It's just the reality, right? And so it makes it different. How we approach this vaccine is different because you're shooting something in my arm that I can't see inside of there. But hear me when I say, I'm not trying to be harsh when I say 1869 is not 2021. And there are Black people who have been a part of this process the entire way. If you hear a Black health professional say, I believe this vaccine is safe, they're saying it knowing full well we have an obligation to our community to have watched every step. I watch every step. Hear me. I want to know who made it, where they studied, how long they studied, what lab they made it in. I'm more likely to watch every step because I know who you were back then. And because I know your history, I refuse to open my mouth and speak to my family, my community, unless I've seen it with my own 2 eyes. And if they're not my 2 eyes, they'll be the 2 eyes of someone I trust. So when you hear a person of color, when you hear a Black person, when you hear an Indigenous person say, I think it's okay, they're typically saying that because they have contact and context with someone who's been on this line of production from either the research side or the physical manufacturing side, who says, okay, that might be all right. Now, I don't know about that other one, but this one, I've seen it. That's a responsibility I, for one, cannot and will not take lightly, because I have to respond knowing full well we have this history. So.
Wow. Wow. Wow.
I loved all that. Thank you. Thank you. Thank you. We are working on, grants and projects and things to address this issue. And that has been my argument again and again. We have to start with telling the whole truth. We have to start with acknowledging our history. It is what it is. If somebody has a time machine, let me know, because I would go and invest in some stock. However, as it comes to what we're dealing with right now, yesterday is not today. And knowing who we still are, right? And if you consider literally where we are, if you look at the news and see what's happening, more people are saying, this is not us, this is not who we are. This is very much who you are. This is very much y'all. And that's okay, because that is who you are. I understand that. Yet, understanding that, I will admit to all of you all who may or may not know that I have taken the vaccine, right? So I've taken my first shot, knowing full well, and if you've seen little kente cloth Kelly with the braids and the, head wraps at 6 years old, like, I have a given name, and it's not Kelly Marie, right? So I'm well aware of who we are as a country, of who the people of power are and what they seek to have and hold. But for me and mine, our decision was to take the vaccine. We have people asking in the comments, should they personally take it? And that is a decision that you have to make for yourself. We can't make that decision. We're here to guide. We could talk through it. We're having this talk. The NAACP is having one, the Buffalo chapter next week. And that's a series. So the information is out there. Apostle?
One of the things I wanted to share with those who are listening, December 28th, I took the first part of the vaccine, the Moderna. I did it because my family, I believe, is more important to me than anything. And what I did was, I want to make sure that it's safe. And to my family, let me go first. Let me go first. And for 7 days, I contacted them. No symptom, no symptom, no symptom, no symptom. To the point to where they said, okay, just wait for the next one, then start giving us an update. And so I'm going to take it. I'll take my second one next week. And so I did it because if there's a mistake, let it happen in me, because I want my family to be okay. I love my family. I'm sharing this with you, and I'm hoping other pastors who understand and do their research. This conversation should help with all the reservations that many of us have, because we got a specialist on the line. But I did it, and I had no issues. Now I'm told that the second part may have some side effects. I'll deal with that when I get to it, but I'll keep my family and friends abreast, updated, so that you can understand that, listen, this may save our grandparents' lives and our family lives. So that's why I did it. And I'm happy I'm representing my own.
Let me just say this so we're clear. Again, I said this earlier, this vaccine works in a very basic way to create a type of inflammation. So if you have inflammatory diseases, please consult your specialist first. If you have allergies, anaphylaxis, you have severe reactions, please consult your specialist. Again, this type of vaccine works to tell your body to respond. It's a message. It literally is saying, I need you to go in and create a response to something that hasn't actually attacked you yet. So there's an inflammatory response, which is why some of the side effects may be, swelling, a little bit of, fever, that's what we expect. So if you have had issues with any kind of severe allergic reaction, any kind of inflammatory disease, you really need to make sure, because there's, again, different vaccines. There's a little bit of difference in them, and you need to make sure that the one you're taking works best with your set of circumstances. That's first, very important. Second, if you're pregnant, gotta talk to, we've seen babies born with COVID-19. That's going to be very dependent on where you are in your pregnancy, the risk factors associated with your pregnancy. So you need to make sure that before you just go sign up, or if you think you may be pregnant, if you're at that point where you might get a positive result, but you're not quite sure, hold and just wait and talk to your caregiver. The other thing is, I think it's important to note, this is a very individual risk assessment, right? The risk assessment has to do with you and your family very specifically. So sit down, right? Sit down. Talk to your family. See where you are as a whole. The apostle said, I care about my family. I want to keep them safe. His risk assessment, much like my own, is, can I keep them safe? Can I do this first? And can I hack? If I do get sick, am I okay? Can I take that? And I can do it. So I think it's very individual. And while there's no one right or wrong answer, make that assessment understanding full well that you must not headline surf, and you must get fact, and you must follow truth. And someone said, children, there is no, anyone under 16 can't take this vaccine yet, because none of the clinical trials tested under that age. So there's no vaccine approved for children under 16.
We are at 8:02. And there's so much more to talk about.
Yeah.
I will not, I won't put you guys on the spot and ask you if you'll come back and do this again. I'll ask you offline if you'll come back and do this again. So just know that as soon as we hit in broadcast, I'm going to ask you if you'll come back and do this again, because I want to help people work through the process, right? What does it mean? What does it look like? I've only taken the first dosage. I take the next one, well, probably next week. And I don't know what that looks like, but I know that I weighed the same options that many other people have weighed, came to the same conclusions about those things, and decided to get the vaccine, right? So however you decide, whether it's for you or your family or not for you and your family, it truly is a personal decision. Unfortunately, many folks don't have primary care physicians, but if you do have a specialist, if you have a medical provider in your healthcare team, talk to them, right? Make an appointment. A lot of things are still tele everything, but make that appointment and have those conversations. Before we go, because I would love to keep you guys for another hour, but I won't. So before we go, can you just both of you give us something that will help folks ease their fear?
Well, I'll let the specialist close us out, and I'll just share with you guys. I had reservations, and I even had some fears. And I'm a man of faith, and I believe the Word of God. I believe the Bible is the infallible Word of God. And that when I read Psalms 91, that scripture applies to me. But at the same time, I felt that I needed to get this vaccine, with knowing that the God that I serve is able to keep all sickness, disease, and infirmities from me. But I felt I needed to do this because I needed to know that it was okay for my family. And so I want you to just listen to what was said today, and hopefully add this to your library of helping you understand this virus, and then make the decision. I don't know what next year looks like. I don't know what 6 months look like from here. But I do know that I'm watching people die from this. I'm watching people die. I go and minister to individuals who are on ventilators, who we're uncertain if they're going to make it. Families call me to go into, and then I'm praying over the phone with the families. And this is daily. And so I'm seeing all people. This has no respecter of person. And I encourage you, if it hasn't hit your home, thank God. If it hasn't hit your family, thank God. But I believe it's in your community. It could be next door. So I want you to do your diligence and really seek your higher power. Seek God and ask Him for direction. And please hear my testimony. Thank you.
I don't know that you can follow that much up. But I will say this, the measure of who we are, the way we are perceived, how we are judged, has to do with how we treat, quote unquote, the least of us. And the least of us really is just about the most exposed, right? It's really about those who are most vulnerable. So if you consider our measure as a human, as a faith-filled human, our measure of humanity, our measure of love is not how we treat us. It's how we treat the least of us, the most vulnerable of us. And how simple is it to take care of yourself, to wash your hands, to wear a mask, to distance, to make a choice, to take a shot, so that when you are measured, you come up high on the mark, right? Above par, because you've done well to the least of us.
Wow.
Thank you. Wow. For all of you watching, please show some love to Dr. Joynicole Martinez and Apostle Garney Davis Jr. Let them know how much I appreciate this guy so much. I read every day, between the coronavirus and social determinants of health and health equity, but I learned some things tonight. You can't read it all, right? You can't do it all. You can't learn it all. And so I appreciate the two of you for giving up some time this evening, for opening yourselves up. And this is not, even though the facts may be the same, it is not easy to continue to have these conversations. It's taxing on the body, it's taxing on the mind, on the spirit, on the heart. So I truly appreciate you both so much. And I will be asking you offline if you will come back again. Until next time, I'm Kelly Marie Wofford. Yes, Dr. Martinez.
I just said, always a pleasure, Apostle. Always a pleasure. Thank you so much for having me. Really. Thank you, Kelly. You're an extraordinary host. I really appreciated my time here.
Thank you so much.
God bless you. Kelly got me. I'm full support. So.
So until next time, folks, you will be able to replay. If you want to be in the know, if you're not really a social media person and I'm Facebook and stuff, you can go over to frontseatlife.com. Front seat life, like you're driving a car, you're in the front seat, you are determining your path. Frontseatlife.com, and sign up for the mailing list, and we'll let you know the next time that we have an event like this and others. So we will see you then. Find us. Impacting Love is on Facebook and on YouTube. And Dr. Joynicole, do you want to give folks your website, how to find you, your handles? I'm putting you on the spot.
No, not at all. You can find me on Twitter at Joynicole M. I'm on LinkedIn, of course. I'm also active on Instagram at The Alchemist Agency.
Thank you so much. Thank you all. Until next time, be the light.
God bless you.
God bless.